So she is our reviser. She should be here any second. And not yet. Committee, if time permits, we will be working the bill we heard yesterday, which was 4:30. If you would take a look at that to let Jenna put her things down and breathe for a second. All right. Committee, we are going to open the meeting today, and we're going to start with opening the hearing on Senate Bill 431, and Janet will give us a bill brief.
Thank you, Madam Chair. Good morning, committee members. Senate Bill 431 allows a pharmacy to employ certain remote workers to engage in the practice of pharmacy and sets out the scope and supervision that would be required of those workers. Subsection A is the definition section. You may pay attention to the definition of remote practice of pharmacy, which is the practice of pharmacy conducted at any location other than an employing pharmacy. Subsection B sets out the conditions for a pharmacy to employ remote workers. Some of those are that the pharmacist in charge will ensure that the pharmacy displays a notice of remote work. The pharmacy is required to ensure that the records are maintained for 5 years for those remote actions. Each pharmacy shall maintain a record of each remote worker engaged in the remote practice of pharmacy for the last 2 years, and that record is required to include the first and last name of the worker, their license, registration, and permit number, their address, where the remote worker is engaged in the practice of pharmacy, their contact information, and then paragraph 4 sets out that personally identifiable information would not be subject to open records requests, and sets out that the typical open records exemption. Subsection C requires a written manual, a policy and procedures manual, to be written and maintained by the pharmacy owner and the pharmacy in charge, and documentation of such review that is required to be done on an annual basis. And that policy and procedure manual in paragraph 1, the requirements are set out, including policies for operating the remote practice of pharmacy, for maintenance of security of those devices, making sure that the remote worker is in a private and confidential area, so you couldn't be doing remote practice pharmacy at a Starbucks. You'd have to be doing it in an area where no one could see the confidential information of patients. It would prohibit things being printed in a remote practice area or being put on any external things like flash drives. There would be procedures for routine audits of a remote worker's activity, and among others. In paragraph 2 on page 3, before engaging in the remote practice of pharmacy, each pharmacist intern would be required to complete their first year of pharmacy school in good standing. Each pharmacy technician would be required to complete at least 240 clock hours of training in the pharmacy before engaging in remote pharmacy work, passing a certification exam. The pharmacy and pharmacist owner would be required to keep all the documentation for the training that the pharmacy interns and pharmacy techs have done. Paragraph 6 sets out that supervision conducted in accordance with this subsection would be direct supervision. Subsection D sets out prohibitions for a pharmacist in remote practice. A pharmacist in remote practice would be prohibited from handling or possessing drugs or devices, packaging or repackaging, compounding, dispensing, or labeling, which sort of makes sense that you shouldn't be taking the drugs out of the pharmacy to package them and then return them back to the pharmacy. Subsection E sets out that a pharmacy intern or technician, they may perform duties related to the prescription process, and communication requests to prescribers through methods. And a pharmacy intern or technician, if they're supervised, can set out the tasks in subsection F, contacting prescribers or prescriber offices, contacting patients, and transferring a prescription. And then subsection G states that a pharmacist engaged in remote practice of pharmacy may supervise with a technician to pharmacist ratio, but shall not supervise any pharmacist intern or pharmacy technician located in the pharmacy. Subsection H is a prohibition on this section applying to medical care facility pharmacists, so this would not be allowed at a hospital pharmacy. And then this subsection K specifies that it would be part of the Pharmacy Act. This bill would take effect upon publication of the statute book, which is July 1. I'll be happy to answer questions.
Thank you for that thorough report, Jenna. Are there any questions? Senator Petty.
Thank you, Madam Chair. I just have one question, and that was on page 3, line 18, where it says at least 240 clock hours of training in, so when it says in the pharmacy, does it mean that specific pharmacy group, or?
It does not specify whether it would be the specific pharmacy. That might be something that one of the proponents would be able to give more information about, because most of the language is written that the pharmacy owner and pharmacist in charge. So at minimum, it would have to be with the same pharmacist and pharmacist in charge, but I'm not sure about if you own 2 pharmacies, if you could split it or not.
Thank you.
Senator Thompson.
Thank you, Madam Chair, and thanks, Jenna, on this. On the top of page 4, line 1, it allows those remote workers to do certain things. It says the prescription process. I guess that means anything to do with handling prescriptions? Would that be for the
pharmacist? This is what would be allowed. I don't think that the prescription process would include filling of those pharmaceuticals, since that's prohibited for pharmacists earlier.
Yeah, I'm looking. I'll have to look and see. I don't see a definition for it. That's what I was wondering what that means.
I don't believe that that's defined, and I'm not a pharmacist, so hopefully one of the proponents will be able to tell you more about what's included in that process.
Thanks, Jenna. Thanks, Madam Chair.
Additional questions, committee? Thank you, Jenna. We will now turn to proponent testimony, and we'll begin with Alexandra Blasi. Welcome to committee.
Thank you, Madam Chair, members of committee. I'm the Executive Director of the Kansas State Board of Pharmacy. My name is Alexandra Blasi. I have been in that role for about 10 years, and I have not had the privilege of testifying before this committee yet this session. So thank you so much for allowing me to be here and to stand on behalf of the Board of Pharmacy in support of Senate Bill 431. As a way of a little bit of history, how this came to be, as you all may be familiar, during the public health emergency in 2020, there was a need to provide opportunities for healthcare practice to continue on with some modifications. And so at that time, the board issued some waivers. Historically, the practice of pharmacy has existed solely within the 4 brick and mortar walls of a registered pharmacy location. And that makes sense because, of course, there's a lot of protected information. Obviously, the drugs and devices that are within that pharmacy need to be secured and provide very strict access to. But what states really discovered during that emergency was that there are a lot of functions now in the world of healthcare, even in pharmacy, that can be performed remotely because they are all truly electronic and based in just phones and electronic devices, whether that be your laptop or a tablet or something of that nature. At the end of those, when those waivers expired, we did have a pharmacy approach the board and request a technology-based pilot project to begin to really test this outside of that experience, particularly with pharmacy technicians, which are in many the same way you might think of a nurse being a support staff to a physician. That is very much what a pharmacy technician is to a pharmacist. So that support staff personnel within the pharmacy. And that facility was a very large mail order pharmacy in the state of Kansas, and so they approached the board with a pilot project, and that was approved, and it's been operational for just over 2 years, very successfully. There have been no complaints or investigations related to their technicians' remote practice in that location, and so at the end of that pilot, that group decided that they were going to work with the pharmacy industry to bring this legislation, and so the Board of Pharmacy does very much support this legislation, but also appreciates the maker of the bill and the bringers of the bill consulting with the board on what the necessary pieces of inclusion would be to ensure that there are appropriate safeguards in place to ensure that only the parts of the pharmacy practice that can be performed remotely safely are included, and those that are obviously strictly should be done with, still within that 4 brick and mortar walls of the pharmacy are remaining in that location. And so that's really the piece of legislation that you have before you for consideration. One of the things that I'd like to note is that this is very much in alignment with the National Association of Boards of Pharmacy Model Act for Pharmacy Practice, and includes key responsibilities that remote workers can do, very similar to what would be allowed in other healthcare settings. So you might notice if you have a friend or family member that is a physician or even an APRN, that perhaps they are, or even a veterinarian, that they are maybe needing to step away to take a call outside of the office or perform some of their note-taking responsibilities and clinical responsibilities, but they're not necessarily in their practice site. And so that would be similar to what is being proposed here. Legislation is important to address some key concerns that are going on in pharmacy right now that this may be able to help support. Number one, recruitment of pharmacy personnel is a challenge right now. And the turnover, just so you know, for Kansas pharmacy technicians is about 15% annually. That's just in registrations. That doesn't account for people that are just leaving jobs and maintaining their registration. So in our group of about 7,500 or so technicians in the state of Kansas, about 15% of those turnover annually. So remote work is an attractive tool for those types of recruiting experiences. Additionally, patient access to pharmacy services is currently limited to the brick and mortar pharmacy hours of operation. Remote work may be able to expand those hours for some types of calls, follow-ups, checking on refill statuses, those kinds of things, in order to enable pharmacies to prioritize provider-patient interactions during those normal pharmacy hours and take some of those back-end systems outside of those normal pharmacy hours of operations. And then third, but probably most importantly, I would say, workplace conditions have been exposed as a significant concern in surveys of pharmacy personnel in the United States. You may have heard about this with slogans like pizza isn't working and other things. APHA has been conducting a well-being index for pharmacy personnel for several years, and the board has been working to address some of the issues that have been highlighted, not just nationally, but some of the things that we've heard from our pharmacists in the state of Kansas, and that includes support of this legislation as well. In 2023 and 2025, the National Association of Boards of Pharmacy did convene a large stakeholder work group to implement solutions to some of the workplace condition issues, and that was joined by many important pharmacy stakeholders and countless other organizations. I've included the report for that from 2025 in your packet, and you can see that remote practice is one of the things that is indicated to help aid, but certainly not a solution fix-all for all of the problems. But that's just one of the avenues that the board has been looking at as an opportunity to alleviate some of those stresses on pharmacy personnel. The necessary safeguards you heard Jenna outline very distinctly. Limitation on duties that cannot be performed would be compounding or dispensing or handling of any drugs. So I want to be very clear that no drugs at any time or devices leave the pharmacy setting for any reason. This is, as the question posed by Senator Thompson was, what is this prescription process? Much of that is happening electronically in the back end of the system. So that's once the prescription maybe gets received electronically or even scanned in by the pharmacy, if that's in the brick and mortar location, then there's a lot of processing that goes on in terms of data entry, reconciliation with other medications that the patient has been prescribed, allergy, that's called a drug utilization review, some of that process. So, and sometimes there's a required outreach to the prescriber. Sometimes it's following up with the patient to find out if there needs to be a drug interchange, like generic substitution, insurance coverage, all of those things. So that really is that prescription process that happens well before the actual drugs are actually dispensed. And that's a little bit of a term of art, but it's not defined here because we did not want that to be restricted and accidentally leave out a small step of the process. In addition, obviously, there are significant record-keeping and training requirements. The question about the 240 clock hours of experience, the board would interpret that as being with that same general employer umbrella and in a similar setting. So, for example, if you had a large health institution that had employed that pharmacy, but they were going to move them maybe to a different campus, it would be perfectly acceptable to allow their hours of training at that other campus to qualify. The goal is really just to ensure that that pharmacy technician has awareness of the processes, policies, and practice for that facility. And that could change a lot even within the chain drugstore retail setting. So maybe if somebody's even going from a CVS to a Walgreens, those processes and those computer systems are exceptionally different. And so we would want to make sure that technician had training with that employer generally, not necessarily that exact location. Last, I would highlight that there is a requirement in the bill that technology would be provided by the employer, and that does also ensure the proper safeguards are set up on all of those devices to maintain strict confidentiality, and then ultimately, very similar to, I would say, what we have in the executive branch, the ability for that employer pharmacy to wipe that device if there was a theft or an incident of any kind, to ensure the proper safeguards for their patient data and information. So I think that is the bulk of what I really wanted to cover, and I know there is additional testimony from the bringers of the bill, but I'd be happy to stand for questions at the appropriate time.
Thank you very much. And we'll go on to our other proponent, and then we'll open it up for questions. John Monroe, welcome to committee.
Thank you, Chairwoman. Members of the committee, my name is John Monroe, and I'm here on behalf of the Kansas Association of Chain Drugstores. Our members include Walgreens, Walmart, Dillon's, Hy-Vee, and Genoa. And we appreciate the collaboration that we had with the Board of Pharmacy in bringing this bill to you. Really, it's already been touched on a couple times already, but it allows for kind of the background work, kind of the paperwork that would allow our pharmacists to who are employed at our locations to do that work and utilize that workforce that Alexandra had talked about, making sure that we were able to retain them and hire on others. So I think really the key part that I wanted to hit on is kind of what we're allowed to do versus what we're not allowed to do. Just for clarification here, and I know it's been touched on already, but something that we would be allowed to do under this bill for the remote pharmacists, we could review prescriptions electronically, we could communicate with prescribers, support patient consultation and clinical review, perform documentation and administrative workflow support, and then assist with pharmacy operations during high volume periods. What it does not allow us to do is handle or possess medications, compound medications, package or label prescriptions, or dispense prescription drugs outside of the licensed pharmacy. I would say those are really just kind of modernizing our language that we have today as healthcare has progressed, and we've utilized more electronics. Just making sure we do this in a safe and secure way is kind of why we're bringing this bill forward, but happy to stand for any questions at the appropriate time.
Thank you very much. Committee questions for either of our proponents. Senator Thompson.
Thank you, Madam Chair, and thanks, John. My question really surrounds the data vulnerability, and that's my biggest concern here because it says the remote practice of pharmacy could be conducted in any location other than the employing pharmacy. Within the pharmacy itself, do they use Wi-Fi or do they use hardline data for internet and transfer of that data? Alexandra, yeah, yeah.
Thank you, Alexandra Blasi with the Board of Pharmacy. I can try to address that question. I think what you'll find is that most of the workstations in facilities are like a hardwire connection.
Right.
But there have been, in the medical care facility setting, which is more the hospital setting, they have allowed for those mobile devices throughout the hospitals
Right.
for a number of years, and they are all based on a secure Wi-Fi connection, as far as I'm aware.
But if somebody's working from home and you don't have a secure Wi-Fi, or that Wi-Fi could be hacked, somebody
Right.
could hack that. My concern is then you've got patient information floating out there that could be hacked.
Right, absolutely, and that would be our concern as well. I think that is the key piece, is that the bill requires that the equipment provided by the employing pharmacy is secured. So that would mean having like a virtual private network, that VPN system, so that even if you're accessing any kind of Wi-Fi system, and I think this would be what we would see similarly with state employees, in fact, that you are utilizing that VPN on the device prior to any connection. And there are actually systems that require that connection prior to being able to access the data and the system.
If I could follow up, Madam Chair. Yeah. And I understand that. But we do audits on all the agencies, legislative post audit, and the vulnerability is all over the board. And these are people who have IT professionals helping guide them. And my concern, anything from multi-factor authentication, password security, things of that nature. And, whether or not a pharmacy intern doing something from home is going to follow that. Or if they decide to go to a Starbucks, how do you know they're not at Starbucks?
Right, and I think your concern is valid. I guess I would say as a layperson, there's probably always a risk. What we see in other healthcare segments like medicine, nursing, veterinary, is that that is how that's handled. There's a secure system portal connection. And so until that security is, that checkbox is reached with that device, they cannot even access the system where they're using their credentials to log into the pharmacy management system, if that makes sense. So I wouldn't say there's any greater vulnerability in pharmacy than there is in any of those other healthcare areas where the professionals are already doing these kind of remote practices.
Okay. Thank you, Madam Chair.
Senator Petty.
Thank you, and this is for Alexandra. So I walked in and it was nice to see you, because in the past, you've been here on a regular basis. And it's like, okay, this is the first time this year, so good to see you again. I was looking at the report that was accessible in your testimony, and I was just curious, because one of the things that's mentioned early on in that report is about mental health. And I'm wondering if there's, if that's, it's not in this legislation, of course, but the whole idea talks about, that pharmacists are dealing with mental health issues. It even says a higher suicide rate. So is that any part of or is that a piece of, as this kind of legislation is being recommended in the state of Kansas, is that a factor to consider?
Yes, it certainly is, and I want to be very clear, we're not able to make a medical link between remote practice of pharmacy and, alleviation of mental health burdens. But we know that is perhaps a contributor. Pharmacies are very busy environments. The demand on pharmacists and their pharmacy personnel is significant. Being able to expand their offerings in terms of how they can recruit personnel, retain personnel, allow those personnel to have a little bit more autonomy in how they're practicing the profession. Those are always things that I think contribute to a better mental health environment. And we are also doing other things to address that issue. We have an impaired provider program in Kansas. We're working with our Pharmacists Association to expand our kind of a well-being platform for pharmacists, and we've done several other things to address incidents in the pharmacy, continuous quality improvement as well. So I think it's one piece of a very large puzzle.
And just as, and my second question was, I had asked earlier when Jenna was giving an overview of the bill about the 240 hours. I think you kind of answered that when you said it would be within the system, so it wouldn't necessarily have to be in that location.
So we would look at the global employer. So for example, I'll just use Walgreens as an example. If you were working at the 10th and Topeka Boulevard location down here at Walgreens, and that is where you did your 240 hours of training, but then Walgreens wanted to move you to the 29th and Gage location, and that was going to be where you were performing your remote services for that location. Because you had the training at Walgreens as a global employer, and we know those systems and processes are the same from one location to another, that would be perfectly acceptable, and the board would find that that was commensurate training to meet that 240 clock hours of experience. So we want to make it as easy for people as possible to be able to have the flexibility, but we also want to ensure that they're not transferring to another employer system that would have totally different electronic features in the background, and they wouldn't know how to use that and be starting in that environment as a remote worker.
Senator Clifford.
Thank you, Madam Chair. Just to continue that theme, could Walgreens train a whole bunch of people in New York City, and then they're servicing Kansas?
Yes, thank you for that question. I should have been clear that no, it would need to be a pharmacy located in the state of Kansas.
Thank you. A follow-up. Will these individuals have access to the prescription drug monitoring data at home?
It is possible that they could if they had received credentials from the Board of Pharmacy, and they would have to be registered delegates under their supervisor. That is, for most of our pharmacies now, the way that they're accessing KTRACS, the Prescription Drug Monitoring Program, is through the Gateway integration, which is integrated directly into the electronic health record system for the pharmacy management system. And that is limited only to the pharmacists themselves. So that is not something that delegates have access to. So that is much more secure.
Thank you for your answer. Thank you, Madam Chair.
I have just a couple of questions. Sorry, John. You look nice standing there, though. When I'm reading in the bill, on line 7, it says each pharmacy owner, pharmacist in charge, remote worker engaged in the remote practice of pharmacy shall ensure the following. And then it goes on line 15 or 14, be configured and properly equipped to engage in the remote practice of pharmacy and be secure from unauthorized access. So that would mean that it's incumbent upon the pharmacist and incumbent upon the remote worker to make sure that they are in an area that is unauthorized, without unauthorized access.
Yes, Madam Chair.
Okay, thank you. Appreciate that. Also, in doing this for pharmacists, I'm assuming that there would be some kind of a savings. Do we have any idea for this pharmacist that has done this kind of on a temporary basis?
Sadly, I'm not sure that I can speak to that. I don't know if you have any information.
Not at this time, but I mean, there's assumptions that could be made, but we can definitely, hopefully with the passage of this bill, we'll be able to utilize that or collect that.
Certainly, as you said, it would be a greater ease of recruitment, and recruitment itself has a cost in trying to interview and get people to come. Committee, any additional questions? Seeing none, thank you so much for being with us. This closes the hearing on Senate Bill 431, and we will now work Senate Bill 430. Jenna will give us a brief on the bill.
Thank you, Madam Chair. Jenna Moyer, Revisor of Statutes Office. Senate Bill 430 would allow licensed physical therapists to conduct those certain capillary blood tests, including the lactate and blood glucose tests that are CLIA certified.
Do we have a motion on the bill? Yes, Senator Thomas.
Thank you, Madam Chair. If it's the appropriate time, I have an amendment.
An amendment is appropriate now. Would you like Jenna to pass that out?
Yes, please. And while she's passing that out, we heard testimony in opposition from Mr. Aller, and so I know there was a conversation had with him and the proponents, and compromising language was agreed upon in the bill to remove language in lines 13 and 14. And so I think in having the mindset of compromise and wanting to improve bills and make them better, I decided to offer this amendment on their bill.
I always enjoy hearing the word compromise when it comes to the proponents and the opponents.
But I will let Jenna explain if.
Okay, Jenna?
Thank you, Madam Chair. So this would change the language for the permitted tests include but are not limited to just permitted tests include. So it would limit the tests that could be performed by physical therapists to the lactate and blood glucose tests.
Any discussion? Do we have you want to move your amendment?
So I'll move my amendment, Madam Chair.
Second?
Second,
Senator Clifford? Any discussion at this point? All in favor, say aye.
Aye.
Opposed? This amendment has passed. We are back on the bill. Do we have a motion on the bill? Senator Thomas.
Thank you, Madam Chair. I move that the Senate pass out, or the committee pass out Senate Bill 430 favorably as amended.
Second? Senator Murphy? All those in favor, or any discussion? All those in favor, say aye.
Aye.
Opposed? This bill has passed and will go to the Senate and committee. That concludes our hearing for today. And we are adjourned. They were waiting for those words. Sorry, I forgot. We are just asking for you to approve the minutes. If you have any amendments or any editing of the minutes, please let Pat know. Otherwise, they will stand approved. Now we are adjourned.